Welcome to my public service announcement on syphilis. I chose syphilis because I watched a couple of YouTube videos on the devastating consequences that the disease has had throughout history. Syphilis has been around since the beginning of time. The type of pathogen. Syphilis is caused by a bacteria called Treponema pallidum. Facts and statistics. 1 in 2,200 people are diagnosed with syphilis in the United States each year. Men account for most of these cases of syphilis, with the vast majority of them occurring among gay and bisexual men. The rates of syphilis are increasing. In 2020, there were 133,945 cases of all stages of syphilis, including 41,655 cases of primary and secondary syphilis. Since 2013, the rates of congenital syphilis has also increased. In 2020, 2,148 cases of congenital syphilis were reported. Modes of transmission. Syphilis spreads from person to person by direct contact with a syphilis sore known as a chancre. Chancres can occur in or on the penis, vagina, anus, rectum, lips, or mouth. Syphilis can be spread during vaginal, anal, or oral sex. Signs and symptoms. The first sign is a small sore called a chancre. This is the first stage called the primary stage of syphilis. In the secondary stage of syphilis, this includes a rash on the palms of the hands and soles of the feet, or even on other parts of the body. You could also have mild flu-like symptoms, like a slight fever, feeling tired, sore throat, swollen glands, headache, muscle aches. Both primary and secondary stages of syphilis are highly contagious. The third and last stage of syphilis is called the tertiary syphilis. This stage can happen 1 to 20 years after a person first gets infected. People in this stage face serious health problems. It can cause tumors, blindness, paralysis, damage to the nervous system, brain, other organs, or even death. How syphilis differs in men and women. The signs of syphilis are the same for both. One thing that I thought was interesting is that sometimes there are no signs or symptoms of syphilis. People might not even know that they have it because the chancre can occur inside the body, or the symptoms are so mild they might be mistaken for something else. Tests to establish diagnosis. There's a test called the Rapid Plasma Region, RPR, which is a blood test. And then there's also some other tests called venereal disease research laboratory tests, which also test the blood or the spinal fluid for syphilis antibodies. The group of people that are at the greatest risk of contracting syphilis. More than 60% of the cases are among gay men between the ages of 15 and 40, with most of the cases in the age range of 20 to 29. The treatment for syphilis. The preferred drug for treating patients in all stages of syphilis is called penicillin G. If a person has had syphilis for less than 1 year, they will only need 1 shot of penicillin G. If they have had syphilis for more than a year, 1 shot a week for 3 weeks is what does the trick. Prevention of syphilis. Abstain from sex or be monogamous. Use a condom and avoid recreational drugs. And this is my public service announcement of syphilis in a nutshell.